it is more and more important to put a guideline. The guideline is actually, and my colleague already talked about that, but I just want to re-emphasize the importance of the guideline in addressing the quality of care and optimize the patient management for a better outcome and also to meet expectation in the management. It also assists, as Dr. Castro mentioned, us and guide us, the medical profession, in selecting the best management strategy, and also to guide the patient about choosing the treatment which is most suitable for them. It also actually lays the foundation for measurement. And I disagree with Dr. Castro. It is not just a guideline, but it is a measure for performance. It's a measure of quality of improvement. And in fact, a lot of the bodies in the United States and the West use the guidelines as a measure of performance of the professional people. And Dr. Castro knows very well that we always address the deviation from guideline. And this term, deviation from guideline, is important measure of the performance of the professional people. So guideline is not just a guide, but it's also a measure. It is a culture. It also creates more professional relation between the providers and also between the administration as a whole in the practice of medicine. As far as the cardiovascular disease is a very good example of the importance of the guideline. And in fact, the American College of Cardiology Foundation and the American Heart Association started that jointly since 1980 and developed a guideline in the area of cardiovascular disease. And they created a task force on the practice guideline. And we all refer to the task force for any discussion of what is the best management. I just want to mention historical issues to introduce the importance of the guideline. And maybe before 1980, in the 70s, 60s, cardiovascular disease in particular, for example, angina, is treated with medication, pills, and sublingual pills is the whole treatment. Nowadays, with all the innovation and advancement in medicine, we have the revascularization procedure. We have hundreds of medication introduced to treat cardiovascular disease. So we need actually to zero down what is the best treatment for each patient. Another historical story, I was a resident in London Hospital in 1983 when angioplasty introduced. And the indication for angioplasty was single vessel disease, proximal disease, proximal 1/3 of the coronary artery, and also the lesion has to be less than 1 centimeter in length and has to be severe disease, more than 80% stenosis. That was the indication for balloon angioplasty before the introduction of the stent. But this is now moved to the extent of even treating left main disease, which we used to call it widower disease, and it was like an emergency revascularization disease. A lot of cardiologists treating this with non-surgical intervention, PCI, percutaneous intervention. Another scenario is totally occluded vessels. Used to be a contraindication for surgery. Many cardiologists now treating total occlusion with PCI. So we really, I'm not going to go into the detail of the guideline for cardiovascular disease because it's such a big subject, but I recommend my colleague to talk again about the guideline and individual specialty. This way we'll have more time and we could actually give the subject more substance. So now we need a guideline to see when we should do revascularization. We need a guideline to see what kind of revascularization we need. What is the best management for the particular patient. In fact, at the beginning, some of the guideline was measured from the physical evidence of the disease. Like, for example, the percentage of stenosis of the angiogram of the coronary artery. This is not anymore is the only guideline. The physiological importance of the particular vessel is more important. What percentage of the myocardium this particular coronary artery is supplying, 50%, 30%, 10%. I give you a scenario. If it is an artery which is severe stenosis, 90%, but it is supplying 5% of the myocardium, I think it is not worth it to have any revascularization, whether PCI or cabbage bypass. So there's now it is based on the anatomical, physiological,